So I guess we will go ahead and get started. Again, my name is Megan. I am one of the advisors for health professions at Cal Poly. And then I'm going to let Connor and Jacqueline introduce themselves. There we go.
Yeah, so hi everyone, my name is Connor Hatfield. I'm a fifth year liberal arts and engineering studies major, and I'm pre-med. And it looks like Jacqueline may be having some Zoom trouble right now, but she's a fourth year biology student and she is pre-optometry, and hopefully she can get logged on here in a second. So,
thanks Connor for introducing Jacqueline for us. So in our office, in our virtual office, these are the services that we offer. Many of you may have already gotten an email about our PreHealth Canvas page. This is basically a library of resources page. And we just sent out, if you just joined the Canvas, you might not have seen the email, but it will be like saved in the history of announcements set out on the Canvas, kind of giving you an overview of what is on the Canvas page. And so we do offer that. We'll go into a little detail on that in a second. Then we also have a blog, and the blog is where we post a lot of information about basically like we will get lots of emails coming to us saying like, hey, will you advertise this event for us? Or we have this job opening, or we're looking for volunteers, or we have this great graduate program that's an option for students as an intermediary in between finishing undergraduate and going on to graduate school, or a summer program or a study abroad program. Some of those things are a little bit more limited right now due to COVID, but we will be posting anything and everything as it comes in. So do subscribe to the blog. We'll have a place at the end where you can have a QR code to scan and go directly to the blog to subscribe. As far as like what our services are with students more one-on-one is Connor, Jacqueline, myself, and then we do have other advisors in our office as well who work mostly more with our students in the College of Science and Math. Our office structurally is housed like in terms of organizational structure, not physical structure. Our organizational structure is that we are housed in the College of Science and Math. And so we do advising for both the College of Science and Math majors. So like if you're kinesiology, biochemistry, public health, or biology major, then we will help you with not just planning for a career in the health professions, but also graduating from Cal Poly. For those of you who are non-College of Science and Math majors, so maybe you're a psychology major or a nutrition major from one of the other colleges, we will help you plan your future career and what you need to do as an undergrad to get to that career, but then your advising as far as graduation goes would be with your advising center. For those of you who are first years, which I think the majority of you are first year students, as far as your advising goes for graduation, that would all be through the Mustang Success Center, and then you'll transition to the advising center appropriate for your college. So essentially what that means is Connor and Jacqueline are your first point of contact for advising for health professions, whether you are a first year student or a new transfer student. And basically we have you meet with our peer advisors up until the point when you take an entrance exam, which is usually at the end of your second or third year. And so what Connor and Jacqueline will work with you on is exploring health-related careers, planning prerequisite courses that you need to take as an undergraduate, and how to balance those with your other major-related courses. And then they will help you to navigate finding different experiences that are health-related, community service, and leadership-focused. So again, that's like where our blog and the Canvas page comes in nice. And then the one-on-one advising is really the attention that you get with Connor and Jacqueline. They do have drop-in hours. We'll have those listed at the end of the presentation. And then we do offer some courses. The one that I really want to highlight to you all today is SCM 101. If you go to our website, You can read more about it, but that class is a class where we have guest speakers from different health professions. So we'll have like a dentist and a physician, a physical therapist, an occupational therapist come to the class once a week, a different profession each week, to just talk about what it's like to work in that field, what their day-to-day is like, what their journey to their career was. Because of budgets, I'm unsure of if that class will be offered this year, but if you subscribe to the blog and if you're added to the Canvas page and you're meeting regularly with Jacqueline and Connor, then you'll hear as soon as we know if and when that course would be offered. If it is going to be offered, it would be in spring quarter. The other classes that are offered more often in non-COVID times, because they are opportunities for you to shadow and do observation with other providers in the community, and the providers, and because of the risk of COVID spread in a setting that manages people's health, it's super risky, and so they're not accepting students to come and do observation right now. But we do offer that. So once we are back to doing things in person, those opportunities hopefully will still exist, and you'll be still here at Cal Poly. So those are just a few of the things that we offer. We also have our website, which Connor is going to talk a little bit about, like where things are housed in our website.
Yeah, so the website is going to be, I would say, your best friend as a pre-health student. We have a ton of information on here. So mainly the Contact Us tab, I just want to mention that's where you can go to either drop in with us, either me or Jacqueline, or schedule an appointment to meet with a staff advisor. So Contact Us is where to go and meet with us. And then if you click on any of these tabs except for the Home tab, on the right side, you will see a little sidebar that shows all the careers listed. And so you click on your career that you're interested in. And so there we have career profiles. So if you're interested in nursing, medicine, PA, whatever it is, for each of those professions, we have a career profile. So kind of a summary of what a typical physician or dentist or occupational therapist does. We have like the training requirements for that profession. So it'll tell you how many years of school, how competitive it is to get into the school, and different training programs you have to go through, like residencies and all that stuff. And also on that page are all the prerequisites for those programs, and they're corresponding to the courses at Cal Poly. So it tells you, okay, you need a year of Gen Chem, and it also delineates what classes those are at Cal Poly. So that's really a super helpful tool as you go to plan out your courses, especially if you're not a biology or biochem major, where a lot of the classes are already built into your degree. If you're able to just go to that website, you can see, okay, I need to add biology or microbiology on top of my coursework in order to meet the requirements for my program. And then all the other tabs too, so experiences has links to different research opportunities, community service. It has tools for like logging your experiences, so you can have those ready to go when you're ready to apply. And then the courses tab, so as Megan was just talking about, the different courses we offer, there we have summaries of what each course is about. We have links to applications for the courses. The applying tab, so for first year students, this really is not going to be of use to you anytime soon, but as you get into your third and fourth year, this is really a comprehensive guide of like from start to finish what you need to know about applying. So it covers when to apply, the cost of applying, how to send transcripts. It has interview tips, really just everything you could possibly want to know about the application process is on there. So again, I just really encourage you to use the website as much as possible. And obviously we're happy to meet with you, but I think there is plenty of information on here that you can get without having to come see us. And the last thing I'll mention from the website is the FAQs. And again, this is another place where you can find answers to a lot of very common questions that we get in our advising meetings. So definitely go through those when you have a chance, and that you should be able to find answers to the vast majority of your questions there. And then this is our PreHealth Canvas page. So as Megan talked about earlier, we just converted from PolyLearn to Canvas. So for those of you who are second years or later, you might have seen our PreHealth PolyLearn. And that's where we had all the resources that we didn't have on the website. So we have interview feedback from students that are currently in health professional school. So if they went and interviewed at Sacramento State PT program, they have the interview feedback, so they kind of give you a summary of what it was like, and we have that for all different professions. We have links to other experiences and opportunities. We have links to different professional organizations for each career. There's just a lot of super helpful information on there. There's personal statement samples. So if you want to get enrolled in the Canvas page, just email prehealth@calpoly.edu and just let us know what your Cal Poly email address is, and we can enroll you. So definitely encourage you to check that out, and it's a super helpful tool for any pre-health student at Cal Poly.
And Connor, can you describe how to get to the Canvas page from their portal?
Yeah, so it should be super similar to how you get to your course Canvas pages. So on the left side of your portal, you'll see the Canvas dashboard. So you just open that up, and it should pop up as a course you're enrolled in. So the same way that you click on those, like those square buttons for each of your classes this quarter, you'll see one that's just called the Pre-Health Professions Program. And you just go into there, and you can access all of our resources that way.
Awesome. Thanks, Connor.
Mm-hmm.
Okay, so since we lost Jacqueline, I'll go over our model pre-health student, who is Patty. So Patty is basically all of the things that you want to have as a part of your application to any health professions program. She is what we would call a complete applicant. And then we've also organized her to be focused on the things that you want to, where your areas of focus will be in each of your, 1 to 2 to 3 to 4 years at Cal Poly. So if you're in your first year in college, then grades and courses, this really should say grades and courses because courses are equally as important. And so that's really you want to start. Of course, it's hard to really be much of anything if you don't have, your brain space filled, right? And so that's where your grades and courses are. And so that's really what you want to start off on working on right now. If you are in a new transfer student, then you might be more down in this area already because you probably have already done a lot of courses and grades and gotten grades. As far as grades go, grades are important regardless of where you are planning to apply to a graduate program. And oftentimes students say, well, I don't have very great grades, but I have great experiences. Just know that it's both. One will not compensate for the other. That said, if you do make a C in your first year, being in college courses is an adjustment. And so like a C in your first year of a transition is not what's looked down upon. What's looked down upon is patterns of C grades. And so one C is not going to be the end all be all, the end of the road for you with this. We'll talk a lot about today the experiences as well. We do have some links and some guides for you as far as experiences that you can get involved in times of physical distancing and COVID. And so there is still opportunities that exist. And really what you want to focus on, what's kind of nice about it being COVID, is it's okay to focus just solely on your courses and grades. And you don't have to like jump right into experiences because there's not a lot out there. And so if you're just focusing on the courses and grades, then you'll be in good shape. Like I said earlier, like end of your second year or your third year is when you'll plan to take your entrance exam, most likely. Sometimes for students, it's not until the end of their fourth year. Everyone is on a different path. And then your application encompasses these 4 things: letters of reference, personal statement, application process, and interviews. And so we will support you in all of that as well when you get to that stage. So. These are admissions competencies that we try and encourage students to spend some time thinking about as far as their admission to programs. Because when we look at Patty, it's very much like, okay, I need to get my health professions experience, my exposure to the health field, my community service, my research, what's counting towards those things. I need to take these particular classes and earn these certain grades. And so when we think about the competencies, it's adding to that, but it's not adding things to do. It's giving you a frame of mind to think about all of the things that you're doing rather than I've done this, let me check that box. It's as I'm doing this experience, how am I developing these competencies? So in your courses, how are you developing critical thinking? How are you developing quantitative reasoning? What sorts of activities are you doing that is allowing you to engage in scientific inquiry? What sorts of developments have you made in your written communication? So how are you learning is a big part of this. It's not just what are you learning. And then the science competencies, this is really where like prerequisite courses come into play as being important. So your living systems courses, your human behavior courses. So it's important to note that all of these health professions do require a lot of science coursework in biology and chemistry. They also require courses in the social sciences because that is kind of the nature of health professions is it's very integrated, it's very interdisciplinary in both the life sciences, physical sciences, social sciences, humanities. And so you'll have courses that you need to take in all of those areas, and they are all of value. It's not just purely a scientific discipline. And if there's anything that we can learn from this year is we've really seen that with healthcare, that how we've seen a huge, strong example of how these social and human dynamics really impact the healthcare of an individual as well as the health of the community. So all of these are equally important. There's more competencies. So these competencies tend to pair nicely with the experiences. So your community service, your health-related experience, research, etc. So these are interpersonal and intrapersonal competencies. So your competencies working with other people, your competencies working with yourself and like your own sense of responsibility and dependability. So again, these aren't things that you have to do like as far as a checklist, but it's more your approach in your experiences. So how are you developing a service orientation through your activities? What sorts of teamwork are you involved in the activities that you're doing? What sort of team member do you play in the different team group work activities that you have, whether it's schoolwork or an extracurricular activity? How have you shown a sense of resilience and adaptability when things have gone wrong? 2020 is a great test of each of our resilience and adaptability, right? So when things have gone wrong or unplanned, how do you cope with that? How do you work through that? How do you persevere? And your capacity for improvement is one that I always really like to highlight. And I call that like having a growth mindset and being a lifelong learner, that you are always open to change, open to growth, open to learning, and you can see all of your experiences as learning experiences, as opposed to seeing your experiences as, like I said, things on a checklist that you need to do. But how are you growing and learning from everything that you're doing, from coursework to your relationships with faculty, to your relationships with your peers, to your activities? How are you learning and growing and expanding in all of those areas? So that's kind of like the one thing and a good mindset to have throughout this entire journey and process is, how am I growing? How am I learning? And if you can tie that perspective to everything that you're doing, you're going to be on the right track.
Yeah, and so now we're going to start going through a few myths about being a pre-health student and getting into a health professional school. And one of the most common ones that we hear is that you have to be a science major to be pre-health. And that's not at all true. You can be any undergraduate major and go on to a health professional school. Really all that matters is that you are developing yourself as a person, that you enjoy your major and you're like getting an enriching experience from that. And that at the same time, you're completing the prerequisite courses for the program that you want to apply to. So you can be a history or philosophy major and go on to medical school as long as you take biology, gen chem, and organic chemistry. So you don't have to be biochem, you don't have to be biology. So we just encourage you to major in whatever you're really passionate about and interested in. You'll be spending a lot of time during your time at Cal Poly taking those major classes. So if you pick something that just you think will look good on your application, but you're really not interested in it and you're not passionate about it, it's going to make your time a lot more difficult than if you choose something that you want to be going to class, you want to be doing the work. It just makes things a lot easier. So also keep in mind the possibility, if you decide that you don't want to go into healthcare, that definitely does happen to students. They may have thought they wanted to be a physician or a nurse, and then they found an interest or a passion in something else completely, or they just realized that healthcare wasn't a good fit for them. So you want to make sure that your major also gives you some alternate career options. So for example, if you chose biology just because you wanted to be a doctor and you really didn't like biology that much, and you decide, oh, I actually don't want to go to medical school, now you're stuck with a degree that you didn't want to do from the start, and you don't really have the goal of medical school anymore. So we just don't want you to be in that situation. It's also important to balance your major and prerequisite courses. So if you do decide to major in something like engineering or another major that has a lot of outside coursework, you may have to be open-minded to the fact that it might take more than 4 years to complete your degree and all of the prerequisites at the same time.
Okay, hi everyone. Sorry I wasn't able to introduce myself. My name is Jacqueline. So hopefully I'm back now. Sorry about the internet connection problems. But the second myth that we wanted to talk about was that becoming a physician is the only career for me. And not just physician, but whatever you had your mindset on when you decided that you wanted to be pre-health. I think this comes down to a lot of the times we don't realize like how many different health careers exist and are options for us. So it's completely normal, and actually it's a good thing if you end up changing your mind, find something that might be a better fit for you. So the best thing to do here is just to explore a variety of careers. Like my kind of personal motto is like never say no to an opportunity you have to shadow or to work with a healthcare worker of any type. Sometimes it's just really opening your eyes to what is out there and what other opportunities will fit with your needs. So that's a big part of the beginning of being a pre-health student, is just exploring the different careers and reflecting on that and trying to find a option that matches your personality and your goals as well. So we'll talk more about how to find those experiences, but really going into it with an open mind is going to be really beneficial to finding the right career and being able to figure out where you fit. So here are some of the other health careers. And just a note, this is just some of them. There are so many options out there. It's like even every day I'm finding new ones that I'm learning about. So it's really cool to know that there's different things that can line up with your own passions and interests. So I won't name all of these myself, but feel free to read them. And then I want to point out the website link that we have on the bottom. So this is on our website, but it's a link to explorehealthcareers.org. And so this is a super helpful website that just goes through some of the different careers and talks about the career projection and career growth, as well as the different education needed to get there. And so this is a great resource just to start and to see what's out there and to learn about what a day in the life of that profession would look like.
Yeah, and so as Megan mentioned earlier, as you're starting out at Cal Poly, whether you're a first year or not, grades are super important, especially if you're going to apply to a health professional program. They really are the thing that gets your foot in the door for interviews. So you could have amazing experiences and you could be doing hours and hours of community service and be involved in research, but if your GPA doesn't meet the standard of the school, it's going to significantly hinder your chances of getting in. So schools will often set like a cutoff GPA. So it may be 3.5 for a certain med school. And not every school does this, but some do, where they say, we're not even going to consider GPAs of below 3.3 or 3.4. So you need to make sure like this is kind of first and foremost in your mind of getting your GPA, like just staying on top of your coursework and realizing that though GPA isn't everything, it is a very necessary part of your application to show that you can handle the rigor of professional school. It's also important to notice that medicine is more than just the hard sciences, as Megan talked about earlier. To fully treat a person, you have to understand the environmental and social and behavioral factors that are going into their health and like the things they do. So if you have a patient that is non-compliant in terms of going to see a nutritionist, but you don't realize that they don't have access to transportation to get there, these are the things that you kind of have to think about to be able to treat the whole person. And you might not get that in a hard science class. We also encourage you to interact with instructors and faculty and to be an engaged participant in your learning. And so really what you get out of these courses is a matter of what you put into it. So if you're just passively taking notes and you're not really thinking very deeply about what you're learning and you're kind of just checking the boxes and getting the grades you need to get, that's really not doing a whole lot for you. You're better off actually trying to get a comprehensive understanding of the material, especially if you have an entrance exam to take. So if you want to go to dental school or medical school, you have the DAT or the MCAT. And so if you're just taking classes and kind of cramming and regurgitating on tests, it's not going to help you very much. So for when you need to go and take those big admissions exams. So make sure that you're really taking the time to understand what you're learning and try to connect things in your mind. So if you learn about a certain process in biochemistry, try to connect that to what you learned in your biology class or your psychology class. And doing that can really help you start to see how these things come together and interact in a medical setting and not just as separate entities or things that you're studying. So. And then we just want to talk about the credit, no credit policy and virtual labs. Obviously, with everything going on, there's a lot of anxiety and uncertainty around how this is going to affect applications to health professional school. And there really isn't a huge reason to be concerned. The vast majority of programs are going to accept virtual labs. It's really not in your control, the situation we're in now. So it would be unfair of them to require you to have in-person labs. So if you do encounter programs that require in-person labs, they're really going to be few and far between. So I would just say make the best of the situation that you can, and just don't worry too much about how this response may look on your application. I think everyone's in the same boat. So I think professional schools are going to have to adapt and figure out a way to be accommodating of that. And by and large, that's what they've done. Like all of the California schools have pretty much unanimously said that they're not going to hold any prejudice or look at online courses any differently than in person. And then credit, no credit, we strongly encourage you to take all prerequisite courses for a grade, just because they are kind of what schools are looking at to gauge your ability. So if it's a GE course or if it's a major course that isn't really reflective of your ability as a pre-health student, or if it's just something that doesn't line up with the pre-health coursework, you may be able to take that credit, no credit, depending on your major allowances. And you can view those online to get an idea of how many units you're allowed. But as far as your hard science prerequisites and any other social sciences, you definitely want to take them for a grade if you can. And if you get to the end of the quarter and you're struggling and say you're at a borderline grade and you're not sure if you should switch or not, feel free to drop in and meet with us and we can kind of help you navigate that situation. And based on your GPA and other factors, we can help you make an educated decision. So. And lastly, so health field exposure. So it's super important to actually get out and get into clinic. And obviously this is difficult right now. So this doesn't necessarily apply to you at the moment, but when things with COVID do improve and you're able to go and shadow and get direct patient contact experience, that's really the best way to figure out if a career in healthcare and which career is right for you. You can have ideas in your mind of what a certain career might be like, but until you actually go and see it for yourself, what you're thinking might be completely different. So you might go and shadow a physician and realize that actually what the physician assistant or what the nurses are doing is much more interesting to you. So like Jacqueline said, don't say no to opportunities just because it's not in the career that you are planning on. You might find something that reveals a different part of healthcare you didn't know about, or you might find a career that is completely different that actually fits you a lot better. And also keep in mind that you want to be able to reflect on and explain like the impact and the significance of what you experienced. So if you had a really meaningful experience with the patient while you were shadowing or while you were volunteering, make sure you take note of that and think about that after you are done with the experience. When you apply and you're filling out your application, you'll have your personal statement. So there you want to be able to explain why you're going into the career that you're going into. And you can use that experience as part of your response. And then also when you're filling out the application, you need to have record of where you volunteered, where you shadowed, the contact information of the doctor you shadowed. So it's a lot easier to keep note of that as you experience it instead of trying to go back 3 years later and remember what the name or address of that doctor was. And then, so we're going to talk about just a few experiences that me and Jacqueline have personally had, just to give you an example. And we just want to emphasize too that there's no right experience. Just do something that you're genuinely interested in. So whether that's research or volunteering, do something you're actually passionate about because you're spending a lot of time doing it. And, you want to be very genuine when you go and interview. If you chose things just because you thought they'd look good, that's going to really show in your interview. So Jacqueline, if you want to go ahead and just talk about a few of the things that you've done. I think okay. Actually, I'll go ahead. So,
yeah, definitely.
Sorry, I think there's a bit of a lag there, but go ahead, Jacqueline.
Okay, sorry. My internet's a little slow still, so hopefully everyone can hear me, but let me know if not. So for health related, just start with that one. The bulk of this for me has been shadowing, and I think that's how I've found the profession that I want to do, which is optometry. They probably mentioned that before. Something I do want to say about shadowing is ask a lot of questions. It's more than just watching how the doctor interacts with the patient, but it's also like you can have that doctor as your resource and you can ask them whatever questions you may have. And I think a really helpful one is sometimes, what is your least favorite part of the job, or what would you change about it or do differently now? So I think it shows not just the positives. Like obviously we want it to be a good experience when you're shadowing, but it's better to learn beforehand the pros and cons of the career you're going into. And if you can still say that you enjoyed it after that, then you know that you're probably in the right place. So that's been what I've done mostly for that. I'm going to start doing some informational interviewing, and that's a really helpful tool during this time when actual shadowing is a little bit more challenging. And then in terms of community service, I personally have been involved with some service in SLO. So I'm not sure how many of you are familiar with the organization Jack's Helping Hand, but I've done some campaigns with them to help raise money for their nonprofit. And I've also done some volunteering through Glean SLO and SLO Food Bank. Those are both some really good options if you're looking for local service. And for my leadership experiences, of course, I'm a peer advisor, so I do that. And I'm also a student assistant for the honors program. So I help with that peer mentoring and planning events for first year students and graduating students as well. And I personally don't have any research opportunities or experience, just because I haven't found anything that I was really interested in. And I think that's another important thing. I know Connor talked about that a little bit, but I almost joined a team and then realized that I had actually no interest in being on that team. I just thought it would look good from application. So I ended up putting my time towards other things like this job, for example, that I do enjoy and that I can talk about passionately, not just as something to check off on my application.
Yeah. And so for me, my health related experience, so I've done some shadowing as well, but mainly I worked for Pulse for the past 2 years. So Pulse is a public health organization on campus. We just do general outreach to encourage students, staff, and faculty health and well-being. So I definitely recommend that if you guys are interested in public health or just health promotion. There's a fitness and nutrition team, a mental health team, an alcohol and substance use team, and also a healthy relationships and sexual practices team. And then for community service, I've been involved with the food bank in SLO as well, and then also just up in Solano County, where I'm from. And then for leadership, I've been a peer advisor. This is my 3rd year now, because Megan's been nice enough to let me come back. So yeah, just really anything that's on this list, and even things that aren't on this list, anything can qualify as leadership experience. It doesn't necessarily have to be health related. So say you're the captain of a soccer team, that's perfectly fine. Just anything that involves you doing something you're passionate about and is growing you as a person outside of the classroom.
And on our website, we have a lot of, under the experiences tab, there's a lot of information and more examples and referrals to other types of experiences. And then the blog will also have a lot of opportunities listed there. So, so just keep your eyes and ears open and you'll find the right experiences that feel like the right fit for you. And it's okay to stop an experience and start something else if you find something that you're going to be more excited about, more curious about. Let's see. There we go.
Okay, so kind of going off of the experiences, clubs are, of course, a great way to start and to get some involvement. And they also offer a lot of opportunities for leadership and just getting involved with community service as well. So here's a list of the PreHealth clubs on campus. Most of them are by profession. Some of them are combined, like you can see like the PA nursing club, they're a joint club. So we definitely recommend that you reach out to the clubs that you're interested in. It can be more than one too, like you definitely aren't limited to only one club, and you don't have to be in only PreHealth clubs, but these are just the ones that we have listed. And it's definitely a great place to start because they will also give you opportunities for that specific career. So different service opportunities or things related to getting your application prepared and just becoming the best applicant and learning from different positions for healthcare practitioners in that specific career. So if you need to find the information, usually you can search it, but you can also reach out to us, or it may be posted on our blog as well if you'd like to reach out to those specific clubs.
And here's our social media information. So we have a Snapchat and an Instagram, and you can scan the Snap code if you'd like to subscribe to that. And we were a lot more active on Instagram, I would say. And for Snapchat, if you do add us, feel free to block us from viewing your stories. I can promise you we're not looking at them anyways. We're rarely on there, but for Instagram, we're going to be posting a lot more of the opportunities that come our way. So if we hear about a scribing position in SLO or a certain clinic is looking for volunteers, we'll be posting on Instagram. So I definitely encourage you all to follow that page if you can.
Okay, and so Megan also mentioned the blog earlier, but here's a little bit more information. So it's just calpolyprehealth.blogspot.com if you'd like to visit it, and here's what it looks like on the right. And then there's a place once you're on the blog on the top right where you can subscribe. So if you enter your email, you get a nightly email with all of the posts for that day, and then you can just filter them. Obviously, some of them won't apply to you, but we have some different filters on the side. So if you're looking for service or for something related to a specific career, you can just filter by that. So that makes it really easy. And then if you scan this QR code, this one actually links to a recent document about different ways to get involved for pre-health students during the pandemic. So that was a post that we had up during the beginning of, I believe, when COVID started, like towards around March time. And so that's just a great resource for pre-health students who just aren't sure where to start right now and you want to get yourself out there, but obviously options are limited. So that's a great place to look for some options.
And finally, here's just our contact info. So you can see Jacqueline and I's drop-in hours here. So basically 8 to 12, Monday through Thursday, with some additional hours on Monday afternoon and Friday morning. And then you'll see our email at the top there, our phone number, and the website. Again, the website has tons of helpful information. You can feel free to shoot us questions via email at that email address. And also, we do have an office on campus, obviously, but we're currently not there. So if things do come back to being in person, we will be in Science North, Building 53, Room 211. Yeah, so I think that's all we have for you guys right now, but we will definitely take any questions that you have. So feel free to raise your hand in the participants tab and we will unmute you and take your questions.